Oh my goodness, what a powerful message from you, Dr. Grace, and from our keynote speaker. I am so excited here. This is wonderful, fantastic. Thank you, National Association of Nigerian Nurses in North America, for inviting me, for existing, for being here. I am just so excited. And thank you so much for inviting me to your virtual scientific conference. It is a pleasure, and it's a pleasure to be before these great nurses and discussing the topic that I love most, which is moving from thoughts and ideas and theories about equity to health equity, and health equity to walking and talk. From walking and talk, I'm sorry, I'm just messing up this morning because I'm so excited. But from moving away from talking about health equity to walking the talk, taking action, and being intentional in your walk. Dr. Allison has presented you with what the National Academy of Medicine is and what it does. And she outlined the consensus study process and how the report was created and reflected on the final project. And Dr. Grace discussed 4 key messages of the 2010 to 2020 IOM report, the future of nursing, leading change and advancing health. And she touched on the 5 key messages from the future of nursing 2020-2030, charting a path to achieve health equity. She brought forth the social determinants of health, as did our keynote speaker. And I'm telling you that I could actually leave now and not say anything else because they covered everything. But what I found from what all they were saying were the daunting statistics from the Institute for Diversity and Health Equity that demonstrated the inequities in the nursing profession across the continuum of the discipline. Those statistics show that in nursing, there has historically been underrepresentation of nurses from Black, Indigenous, and also populations of other people of color. Dr. Grace laid out a solid foundation for leadership, nursing practice, and involvement in policy and politics. But my next slide will further address equity. So I asked, how do you view equity? And we cannot discuss equity. We cannot discuss equity without discussing health inequities. And Dr. Grace talked to you about that. And remember what she said. She said social conditions in which people live and interact are influencers that impact health outcomes. Our keynote speaker spoke of that too. And I keep saying our because I feel like I belong right here with my Nigerian Nurses Association members. And I want you to remember that not everyone has the same need. And not everyone is treated the same. As you've heard before, your zip code can influence whether you receive individual health care that meets your specific needs. Health inequities would not exist if there was no discrimination, prejudices, or racism. So to address it, you must first work to dismantle racist ideology. Now let's use this infographic to see how one may view health equity. So what we see here is that everyone has the same box, right? This is symbolic to equality because everyone has the same box. The question is, will it meet each individual's need? And as you can see, it does not. I also want you to take notice of the wooden fence there, because that will be significant as I continue. So when you look at the first image, you see those persons with the same box. And then you go to the middle image. And in that middle image, you see that the shortest person has 2 boxes. And then the next to the shortest person, or I should say next to the tallest person, that person has 1 box. But does this represent equity? And I love what the author of the infographic did by removing the wooden fence there and replacing it with that mesh fence. However, is this practical? And when I go to, I'll talk to you a little bit more about that when I move to the next slide, because what I'm thinking about here is there's no diversity here on that previous slide. There was no diversity except for maybe a diversity of height. And also you see that they are outside of the fence. So it's lacking in inclusivity because they are not there. They are not at the baseball game. Perhaps they couldn't afford the baseball game. So while I believe there is no diversity and inclusion without equity, we must also realize that there would be no equity if we all looked the same, received the same opportunities, lived with the same benefits, and did everything the same. To me, that would make for a boring life because I love, love, love diversity. It's why I miss living in New York, because I was surrounded by people from all walks of life. So again, how do you view equity? And does this picture represent equity? Or is there still something missing? And that's what I will discuss with you in my next slide. So in the previous images, they did not consider that the person may not be able to stand, right? And again, in this image, which is from the Robert Wood Johnson Foundation, in this infographic, it addressed the issue of equality versus equity. But as you can see, if you give everyone the same bike, that demonstrates equity. But what about the person who cannot stand and they cannot ride that bike? So you're looking at the person in the wheelchair, and then you're looking at the person that's too tall for the bike, and the other person that's just too small for the bike. So the bike is only fitting the need of one person. So one of the things that I like about this infographic is that they're showing that equity is very important. But I showed this slide to some students when I was presenting at James Madison University. And I asked the students to look at the slide. And these were freshmen, straight out of high school, first-year students, mostly first-year students. And some of them looked at it and they said, okay, all of the people are purple. So they were looking at the fact that there was not diversity there. And then they also asked me, why was the person who is disabled, why is that person in the back? So, you know, even when we have the greatest of intentions, it can have some unexpected consequences. But you always want to espouse equity and ensure that individuals are treated fairly, have access to the same opportunities according to their needs, and that no one is excluded. And I'll talk a little bit about that also in my next slide. And I want you to know that even when you think you're depicting something that is equitable, we still may need to do additional work, because this process is an ongoing process. And so from the words of one of the politicians that I know, he says that we must not sleep. And he said, you sleep when you're dead. So let's talk more about improving health equity next here. And before I speak on improving health equity, let's hear what Dr. Sue Hasmiller had to say about it.
Concept that we all can have health and well-being, right? Many of us in our organizations, including my own, are fully invested in advancing health equity. The Robert Wood Johnson Foundation is devoted to building a culture of health and has pledged to dismantle structural racism. I am heartened by the number of individuals and organizations that have plans to take action on the report's recommendations. So many people that I've spoken to in the presentations that I've been doing via Zoom, of course, say that they're going to incorporate this into their strategic plans. It's just fantastic to hear. That's real action. That is real action. Meanwhile, we're excited to see once again that tons of people are downloading the report. Keep downloading, keep downloading.
Yes, keep downloading. So in June and September, I had the pleasure of attending a campaign for action. It was a virtual summit. So this picture actually was taken some years before, but it was a virtual summit led by Dr. Sue Hasmiller and Dr. Deborah Reinhardt. And it was such an honor to participate in this groundbreaking summit to explore the newly released National Academy of Medicine report, The Future of Nursing, as you know, again, charting a path to achieve health equity. We broke out into 28 teams to workshop each of the report's 54 sub-recommendations. And it was under its 9 major recommendations, which I will share with you later. And we answered questions including what multi-sector partnerships, and you heard our keynote speaker speak of partnerships, and also Dr. Grace, but what multi-sector partnerships are needed to implement the recommendations? And then what milestones or benchmarks will tell us that we've succeeded? So the result was 54 draft action plans, each with specific tasks, timelines, and also goals that will help you to transform healthcare, and health equity for all. And I will dwell deeper in health equity in the next slide. So going back to what Dr. Grace said about social determinants and health equity, the report considers how nurses should best address social determinants of health, and as discussed by Dr. Sue Hasmiller, provide effective, efficient, equitable, and accessible care for all across the care continuum. It is great to ensure that everyone gains access to the same resources according to their needs, but true health equity requires us to always address those disparities that can prevent people from living full and healthy lives. Now that you've heard more about health equity, I'm also going to talk to you a little bit about the crisis that causes health inequities. And one of the things that come to mind is disproportionality. Over representation or underrepresentation of a racial or ethnic group compared to its percentage of the total population, and then disparity and unequal outcome of one racial or ethnic group compared to another. So I want you to think about what we saw during the COVID-19 pandemic. What did we learn from that? As a member of the Virginia Governor's Long-Term Care COVID-19 Task Force, the statistics for Black people dying from COVID were daunting for people living in certain zip codes. And the pandemic, it didn't just impact, it did not impact all populations equally. And according to the Campaign for Action website, Native Americans, Black people, and Latina people were significantly more likely to die from the virus. And when the data is adjusted for age, oh my goodness, the differences between the populations, it reveals that those groups were 2.7 times more likely to die than white Americans in 2020. So please access the APM Research Labs Color of Coronavirus project. You can find that at the Campaign for Action website for more information on this pandemic's unequal impact on certain populations. And this data was so significant that, as Dr. Allison shared, the New Future of Nursing report was released late because they wanted to address the pandemic and its aftermath, and especially the inequities. And as you know, the unequal impact has been felt hard by nurses and other healthcare providers, because over 32% of nurses have died during this pandemic. And our nursing homes, which is my environment, were hit hard. And again, the deaths were disproportionately among people of color there. And when we talk about the challenges of challenging injustices, aside from the pandemic that has impacted people globally, we have been met with unprecedented challenges. And Dr. Sue Hasmitter, as she said best, she started out the summit talking about this, that we have seen a movement for social justice unlike any other since the civil rights movement. And I remember that civil rights movement well, because one of my mother's first cousin marched with the late, great Martin Luther King and with the late, great Congressman John Lewis, and they were arrested numerous times. And then, as our keynote speaker talked about the murder of George Floyd, and I always like to say their names, and they're too numerous to name all of them, but George Floyd, Breonna Taylor, Ahmaud Arbery, Elijah McClain, they were months apart, and it was the catalyst for the Black Lives Matter movement. And it caused many people, including nurses and other healthcare providers, to think more critically about race, power, and privilege. And it is incumbent of all of us as nurses to challenge injustices. And I want us to think about the NAM statement of tasks. It calls for us to identify system facilitators and barriers to health equity. So you should see this in your organizations, your institutions of higher learning, and they should all be developing stronger diversity, equity, and inclusion statements if they did not do it previously. And it has to address racism and systems of oppression. So, do you have what it takes to be one of these change agents, one of these champions of change? I think that you do. I think all nurses, we have the voice. We know what we need to do. We just need to do it. And according to the Campaign for Action, it's time for us to roll up our sleeves and jump in and create health equity in this United States and globally, everywhere that is needed. And you know, we were living in a country that is divided by politic shenanigans, hatred, and discrimination. And it further causes disparities and inequities. And so it's time for us to take action. Be a Mary Eliza Mahoney. You know, Mary Eliza Mahoney is the first Black woman who graduated from a nursing school in the United States. You know, we talk about Florence Nightingale, but in the United States, it was Mary Eliza Mahoney. And she was an advocate. She was a change agent. She was a champion. And she started advocating. She became a nurse late in age at 33, similar to me at 44. And then she started advocating. She became one of the first Black nurses to vote in the state of Massachusetts, in Boston. And she just started advocating for nurses and for all people that were underrepresented and underserved. So I will talk to you and show you some of the resources for becoming a change agent in my next slide. And again, and you may not see this very well because the slide is yellow, but there's a slide. There's one of the resources I wanted to share with you is something that's by Dr. Susan Hasmiller, and it is called Perfectly Positioned. And then there's Dr. Patricia Polanski, See What Nurses See. And the Campaign for Action has Population Health in Nursing. And then another one that is excellent, an excellent article that focuses on what nurses can do to address racial disparities is it's not just unfair, it's inequitable. And so the best thing that you can do is, again, become a champion and champion health equity and diversity and inclusion. And ask yourself the question, how should I serve as a change agent in creating systems that bridge the delivery of healthcare and social needs and care in my community? Just ask yourself that question. And there are many resources. I want you to please use the website, go to the Campaign for Action website, and you will find many things there. And you also have action coalitions in your state. And they carry out the work of the campaign at the local, regional, and at the state levels. So just know that it's imperative that we ally with other people and engage in collaboration with with other disciplines, not just with nursing, as our keynote speaker has said before. And on the next slide, I will share with you 9 draft action plans that we addressed during the summit. And I'm not going to go over these, but these were draft work plans. These are examples, and this presentation should be provided to you. And those are links that you can click on and access them from the campaignfromaction.org website. So on my next slide, this is a sub-recommendation action plan. This is sub-recommendation action plan 2.1. But there are 11 sub-recommendations for recommendation 2. And I just wanted to share with you what it looked like. These are the plans that we worked on. We looked at the key strategic stakeholders, and we gave different stakeholders. And then we looked at the top 3 to 5 actions for 2021 that we wanted to address, and the top 3 to 5 that we wanted to address for 2022. And again, these can be found on the website. And I just wanted to share with you what it looked like. So on my next slide, I want to talk about moving toward equitable excellence. And I want to say, when I think of diversity, most people, when they think of, as soon as you say DEI or you talk about diversity, they start thinking about race, But when I think of diversity, I'm more concerned about diversity of thought. I want to know what each individual will bring to the table. What are you bringing? And when I think of a lack of diversity, I think about going into a flower shop, because I love flowers. And I think about going into a flower shop and I only have one type of flower to select from. And that is boring, as I don't take the same route home every day because I don't like monotony. I love for things to be different. So that's what I think about with diversity. And equity, again, is a process that you and the people who make up your healthcare organization must consistently engage in to ensure that people who identify as underrepresented and underserved have the same opportunity to develop and succeed as their counterparts. And if you notice, I don't use the word minority too much because that means less than. So you will hear me using the terms underrepresented and underserved. And we must embrace those who are different from us. For example, how can we have animus towards immigrants when we live in a nation of immigrants? Let's work on dismantling racism together. Think about it as, think about it. I want you to think about when we embrace diversity, espouse equity, and ensure inclusivity, and promote justice in all we do. We move the equity needle more towards inclusive and equitable excellence. And that's what I want us all to think about and go about doing this in your daily lives and in your professional life. And I must leave you with my adopted mantra. And these are the words of the late, great Congressman John Lewis.
You see something that is not right, not fair, not just, say something, do something, get in trouble, good trouble, necessary trouble.
And that is what I do. I do it on a daily. I have several masks that say good trouble. And I wear them when I'm out and about so people can know. And my t-shirt that says good trouble is always necessary for us to dismantle racism, promote diversity, equity, and inclusion, and address social injustices. Again, it has been my pleasure to be here with you today. And now I will turn things over to my esteemed colleague, Dr. Sandra. Thank you.
Wow.